Hello everyone, welcome to Bajirao IAS Academy's daily newspaper analysis. Today is 31st January 2026 and today we are going to discuss some important topics from different newspapers. So the first topic is about India-Arab League, and in fact this is going to be the second India-Arab League summit meeting India has hosted. Now in this context we'll understand the importance of this particular India-Arab League and so how it is going to create new opportunities for India. Then we'll also understand about the out-of-pocket healthcare expenditure in India. So really expenditure or health expenditure from the center has increased, or still the public, the out-of-pocket expenditure is very high. We'll understand those things. And then economic surveys concerns about unconditional cash transfers and how this is going to have a fiscal burden on the states. And then we'll also understand that how ethanol blending has impact on food security in a country like India. Then recently the Supreme Court has recognized that menstrual health is part of Article 21, right to life and personal liberty. And lastly, we also discuss Jal Jeevan scheme, its objectives, and what is the recent survey has been pointing out with respect to the Jal Jeevan mission. So these are very important topics. So one by one, we'll be discussing all these topics. But before that, in previous class, there was a prelims practice question with respect to the Nipah virus. Because this Nipah virus cases have been increasing in the state of West Bengal, and there is a concern about this virus as well. But let's first understand what exactly is this Nipah virus, and then we'll try to solve this question. Right. So 196 contacts linked to Nipah cases found negative in West Bengal. Right. So but before that, let's understand about this Nipah virus. So understand that Nipah virus, NIV. So it is an infection so that newly emerges zoonosis. Now what exactly is a zoonosis? Now zoonosis is a disease that actually spread from animals to human beings. So these diseases are zoonotic diseases. So therefore that actually cause a severe disease in both animals and humans. However, the first identified case of Nipah virus was found in 1998 and outbreak took place in Malaysia. Right. So however, a fruit bat is actually the natural host of this Nipah virus. Now one thing that we should understand that Nipah virus is a zoonotic disease, and the first outbreak of this Nipah virus was found in Malaysia, and fruit bat actually acts as a host of this Nipah virus. Right. Now in fact in India also there were previous outbreaks of Nipah virus, particularly in the state of Kerala at a place called Kozhikode. And apart from that, Siliguri also there was an outbreak, and Nadia of West Bengal also there were outbreaks. Now if you look at the symptoms of it, the fever, headache, coma, drowsiness and confusion and disorientation. So these things could be the symptoms of Nipah virus. And what is more concerning about this Nipah virus is those people who are actually infected with this Nipah virus, they are going to have 70% mortality rate. So 70% is very high mortality rate. And it first broke out in Malaysia and then Singapore 1998 and 1999. Right. So therefore I hope you have understood some basic details about the Nipah virus. And if we talk about the medication or any vaccine available for this, no vaccination is currently available to treat this Nipah virus, and that is actually the concern. No vaccine is available for this virus, but the symptoms can be treated with the particular medicine. Right. So therefore the treatment includes intensive support care for the humans treating these symptoms. Now human to human transmission is also a possibility with respect to the Nipah virus, and fruit bat, they generally act as a host of this Nipah virus. Right. Now let's understand this. If we talk about this, consider the following statements regarding Nipah virus. It is non-zoonotic disease. No, this is incorrect statement. This is virus, but this is a zoonotic virus. Zoonotic virus is any virus which transmits from animals to human beings. So that is what is known as zoonotic disease, animals to humans. And then So therefore this statement is incorrect. Domestic poultry birds are the natural reservoir host of Nipah virus. This is also incorrect statement because the fruit bat acts as a reservoir or a host of this Nipah virus, and this statement is also an incorrect statement. And then effective antiviral drugs or licensed vaccines are widely available for the treatment and prevention of Nipah virus. No treatment is available, but no vaccines to treat the Nipah virus. So specific vaccine is not available for the Nipah virus, but symptoms can be treatable. So the correct answer for this question is D, none of the above. So none of the above is the correct answer for this question. So I hope you have understood some basic details about the Nipah virus. And there's an important article about the Mahatma Gandhi National Rural Employment Guarantee Act. Recently, economic survey has been introduced, and this economic survey has actually backs the decision to change the structure of Manrega as Vikasit Bharat G Ramji Act. Vikasit Bharat G Ramji Act. Right. So fundamentally, Manrega scheme has been changed, and economic survey has actually backed this fundamental or structural change of the Manrega program. With reference to restructuring of the Manrega, consider the following statements. Now, first statement says that focus has shifted towards creating a durable and productive assets. Greater emphasis has been placed on convergence with agriculture and allied sectors. The scheme has been converted into a fully conditional cash transfer scheme. Right. So try to answer this question in the comment section, and we'll be discussing about the Manrega program and restructuring of the Manrega program as Vikasit Bharat G Ramji Act. Right. So therefore, let's go into the discussion and let's try and discuss these topics in detail. The first topic is about the menstrual health in schools is an integral right to life. So in fact, Article 21 of the Indian Constitution, so it talks about right to life, and Article 21A of the Indian Constitution, it talks about the right of free and compulsory education to children who are in the age group of 6 to 14 years. 6 to 14 years free and compulsory education or primary education. So recently, the Supreme Court, in a judgment called Jaya Thakur versus Government of India. Now, in this particular judgment, the Supreme Court has held that access to the menstrual health or menstrual hygiene in every school is actually part of Article 21, which is right to life. So it is part of Article 21 of the Indian Constitution. And Supreme Court has also issued directions to all schools to provide free sanitary pads and even gender segregated toilets. So there should be separate toilets for girls and boys. So which are gender segregated toilets for girls, and at the same time provide free sanitary pads for girls. So because the menstrual hygiene is part of the fundamental right under Article 21, so therefore this is going to bring some fundamental changes in the way schools are actually providing access to the gender segregated toilets. Schools are providing women, or particularly the girl students, access to the menstrual hygiene and related infrastructure. Right. So what Supreme Court has held in this context? The Supreme Court has held that all schools must provide menstrual hygiene access to students. Now it is mandatory for all the schools because the Supreme Court has also rightly recognized that access to menstrual hygiene is part of Article 21 of the Indian Constitution. Now in fact, if any school don't have the menstrual hygiene management, if any school is not following the menstrual hygiene properly, or it has not been providing the necessary infrastructure, it actually undermines a dignity of a girl child. Understand Article 21, it talks about right to life and personal liberty. So since it recognizes right to life and personal liberty, so if any school which has not been following the menstrual hygiene management, it has been clearly violating the dignity of a girl child, and it is violation of Article 21. And understand that right to privacy is also recognized as part of Article 21 of the Indian Constitution under Puttaswamy judgment. Right? So therefore, girl child's right to privacy and bodily autonomy are inseparable, and in fact they are closely linked to the dignity of a girl child. So therefore, the Supreme Court has rightly recognized that the right to life under Article 21 encompasses the right to menstrual hygiene as well. So that's how the Supreme Court has actually linked the menstrual health, menstrual hygiene of a girl student to Article 21 of the Indian Constitution. So therefore, the denial of the menstrual hygiene by the schools, so it leads to denial of girls' equal participation in schools. So therefore, it is very clear that we have another article, which is Article 21A. So Article 21A, it talks about free and compulsory education to children in the age group of 6 to 14 years. So therefore, it also covers expenses that hinder a child from completing elementary education, and that should extend to providing free sanitary napkins to the girl students in every school as well. Right? So therefore, this is how the Supreme Court has actually rightly recognized the right to menstrual hygiene to every girl child. And in this context, the Supreme Court has also rightly talked about Article 21 of the Indian Constitution. Article 21, it talks about right to life and personal liberty. So therefore, the denial of sanitary hygiene, sanitary pads, if not followed by the schools, if not provided by the schools, it amounts to the violation of Article 21 of the Indian Constitution. Menstrual hygiene and segregated toilets actually an integral part of dignity of every girl's student. And Article 14 talks about the equality. So therefore, the Supreme Court has also talked about the gender equality, invoking Article 14 of the Indian Constitution. So if any school which has not provided the menstrual hygiene related infrastructure to the girl students, so it creates a gender specific barrier. If there is no segregated toilets, if there is no access to the menstrual hygiene for girl students, so therefore it actually creates a gender specific barriers, and that prevent girl child from equally competing with the boys. So therefore, Article 14 has also been invoked by the Supreme Court in this context. And another important article is Article 21A, right to free and compulsory education for the girl child. Free and compulsory education for the girl child. So not just for the girl child, but also every child in the age group of 6 to 14 years. Now in this context, the ruling from the Supreme Court in this particular judgment, so that ensures a menstrual poverty does not force girls to drop out of the education system. So therefore, this is the responsibility of every school to provide sanitary napkins free of cost to every girl student. Right. What are the major outcomes of this judgment given by the Supreme Court? Now, if we talk about the major outcome, every school must and mandatorily provide sanitary napkins to every girl student in the school. And these schools include both government schools as well as the private schools. And the sanitary napkins must be provided free of cost, and they should be the biodegradable in nature, and the sanitary napkins must be provided to the girls in the age group of, or in the classes from 6 to 12 years. And then the Supreme Court has also mandated the necessary and relevant infrastructure that must be created in these schools in line with the directives issued by the Supreme Court in this judgment. So schools must ensure the functional, gender segregated and disabled friendly toilets. Every school, whether it is a private school or a government school, every school must mandatorily provide the toilets. Toilets should be gender segregated. they should be functional toilets, and they should be disabled friendly as well. So equal access. And apart from that, the establishment of menstrual hygiene management corners in every schools. And these menstrual hygiene management corners in every school will be equipped with spare uniforms for the girl child, innerwear, disposal bags for the emergencies as well. So therefore, every school must also have the menstrual hygiene management corners as well, along with the necessary infrastructure, along with providing sanitary napkins free of cost to every girl child. And then there are enforcement and accountability mechanisms as well to make sure that these guidelines are followed by every school. District education officers, they must conduct annual inspections, collect anonymous student feedback, and non-compliant private schools may even face the derecognition as well. The government may derecognize if schools are not aligning themselves with these guidelines issued by the Supreme Court. So therefore, these are mandatory guidelines that every school, private school and the government school, must follow in all the states. So I hope this topic is clear for you, and the next important topic is about the Jal Jeevan scheme. Now, Jal Jeevan scheme is a very important scheme, and this scheme has been launched with the objective of providing potable drinking water to every rural household. And in fact, this Jal Jeevan mission is in use recently because a 2024 government commission survey has revealed some important details about this Jal Jeevan mission. So what details have been revealed? That 98% of the rural households, they have tap connections under the Jal Jeevan mission. Around 98% of the beneficiaries, they have the tap connections under the Jal Jeevan mission. However, it is a massive success that achieving this 98% tap connection, this is not an easy task. So even though 98% of the beneficiaries have tap connections to provide potable drinking water to every rural individual, only just a 3/4 of these beneficiaries who have tap connections, they are actually getting reliable and safe water supply. And the objective of Jal Jeevan mission is to provide reliable and safe water supply. But here the irony is only 3/4 of those who have tap connections are actually getting the reliable and safe water. So therefore, this is a concern that is associated with the Jal Jeevan mission, and this has been highlighted by a government commissioned survey recently. Now let's look at the objectives why this Jal Jeevan mission has been launched in India. The Jal Jeevan mission has been launched to provide piped drinking water to every rural household by the year 2024. So this is one of the objectives of the Jal Jeevan mission. And then integrated demand and supply side management of water at the local level. And then it also converge the central and state level government schemes, and it will also create the local infrastructure for the rainwater harvesting, groundwater recharge, management of household water for reuse in agriculture. So therefore, Jal Jeevan mission is actually integrating all these important components as part of it, not just providing potable drinking water to every rural household by 2024. Now let's briefly understand some other details about the Jal Jeevan mission. This mission was launched in the year 2019. Now what is the objective of the Jal Jeevan mission? The objective of Jal Jeevan mission is to provide functional household tap connections, FHTCs. So functional household tap connections to all rural households by the year 2024 is actually the objective of the Jal Jeevan mission. And also the scheme seeks to ensure 55 liters of potable water per person per day. So the water will be provided on regular basis, and also the importance will be given to the quality water supply. reliable water supply, sustainability of source. Sustainability of source also includes rainwater harvesting, water management, groundwater recharge, and reuse of the household water for the agricultural purposes. And community participation is also a key element in the success of the Jal Jeevan mission. However, there were programs earlier than the Jal Jeevan mission, but earlier programs actually focused on water supply, or they focused on infrastructure creation only. But if you look at the Jal Jeevan mission and how it is different from the earlier programs, is that so it has adopted the service delivery approach. And under the service delivery approach, the functionality will be looked into, water quality will be looked into, and even the regularity as well. So therefore, the functionality, water quality, reliability, and regularity are the central performance indicators of the Jal Jeevan mission. But earlier programs, they just focused on infrastructure creation alone. Right? So in fact, the mission is implemented in partnership with several states, which funding shared between the center and state governments both. And in fact, the Jal Jeevan mission will actually help implement some of the sustainable development goals as well. For example, it is sustainable in nature because it integrates sustainability as a concept, and then water will be affordable because 55 liters of quality and reliable water will be provided free of cost to every individual, and high quality water, equity and inclusivity, and even reliability and adequate quantity of water will be provided. So therefore, the Jal Jeevan mission will also help achieve some of the sustainable development goals as well. Now, what are the salient features of the Jal Jeevan mission? Now, if you look at the salient features of it, the community participation, sustainability, reliability, emphasis on quality, emphasis on creation of infrastructure are some of the salient features, along with capacity building and providing technical assistance. Mandatory source sustainability through Manrega, rainwater harvesting, and information, education and communication, which is IEC, information, education and communication campaigns for the water conservation. So these are the objectives or the salient features of the Jal Jeevan mission. However, according to some official data, the Jal Jeevan mission has expanded the tap water coverage because around 98% of the beneficiaries have tap water connection, the functional household tap water connection. And in fact, if you look at the data before 2019, only 20% of the rural households have access to the functional household individual tap connections, but this number has increased from 20% to 98%. So therefore, it indicates a massive success of the Jal Jeevan mission launched by the central government in the year 2019. Now, there are several states where the availability of functional household tap connection is more than 97%. Those states include Andhra Pradesh, Union Territories, and Gujarat, Goa. So these are some states and union territories which have more than 97% functional household tap connections. Now, in fact, 2.7 lakh villages have been certified as Har Ghar Jal villages. So therefore, this is the motto that has been adopted as part of the Jal Jeevan mission, that 2.7 lakh villages have been certified as Har Ghar villages. And this has been indicating that all households and public institutions in these villages are actually having access to the water under the Jal Jeevan mission, and this is a massive success. So however, even though the water is individual functional household tap connection is established, but here the problem is reliability of water, quality of water. So this component that the government must work on. So sustainability must be ensured, quality water must be provided, and water must be provided every day. So that is very important. So reliable water supply is very, very important in this context. Now let's understand another very important topic about Second India Arab League or Second India Arab Ministers Summit meeting that India is going to host. Now in this context, what opportunities it actually provides for India. So why Arab League is very important for India? What is Arab League? So we'll be looking into all these things. Now understand that the foreign ministers of 22 member Arab League, so they are going to meet in New Delhi for the second India Arab Foreign Ministers meeting in January 2026. So this meeting is already taking place, and the foreign ministers of Arab League, they also came to India and they also participated in this second India Foreign Ministers Arab India Foreign Ministers meeting. Right. Now in fact, this gathering from the Arab League foreign ministers and India, particularly at a point of time when there is a West Asia instability. Now West Asia is also going through instability because of several reasons. So there have been proxy wars, so this could be one reason, and apart from proxy wars, there could be Hamas-Israel conflict, then Saudi Arabia-Iran conflict, fourth, Iran civil uprising, right, or civilian protests. So we could say that the West Asia has been going through the instability phase, and there is also a great power rivalry in the West Asia. However, one thing that we should understand that in recent times, in the past and now also, India's interests have been increasing in West Asia, whether it is energy interest, security interests. So all these different types of interests have been increasing in West Asia, particularly for India. So West Asia is a very important and a reliable supplier of crude oil and other energy resources to India. Now at this point of time, the India Arab League Foreign Ministers meeting is a very important, particularly for further strengthening India's strategic relationship with the Arab League countries, and also further strengthening India's evolving foreign policy that is able to better respond the existing geopolitical issues, the existing instability, and also India to better protect its existing interests in the West Asian region. Right. So let's understand the geopolitical flux and the strategic context of this India and Arab League meeting and how it is going to affect. Now understand that there is a regional volatility. Regional volatility particularly you could see in Gaza, Iran and Syria, Yemen, particularly Houthis militant in Yemen. And Houthis are a proxy group, a proxy militant group. So all these things have resulted in instability or security uncertainty in West Asia, and this has also created a kind of a diplomatic volatility in the Middle East, diplomatic volatility as well. So therefore in this context, India's interests which are involved in the West Asia, so what interests India is actually having in West Asia, we need to talk about the trade. We should also talk about the connectivity and infrastructure. For example, if we talk about the connectivity and infrastructure, India, Middle East, Europe economic corridor. And then we should also talk about the security and defense cooperation, and then the energy cooperation, along with that the diaspora population and protection of diaspora interests. So therefore India is having certain interests in the Middle Eastern region, and India needs to protect those interests along with further strengthening its engagement with the West Asian region. So therefore this India and Arab League meeting is very important. And also understand that there have been emerging tensions between Saudi Arabia and United Arab Emirates in recent times. So in fact there is some kind of a competition, and also understand that India is having very good relations with both Saudi Arabia and UAE. So if these conflicts or tensions between India and Saudi Arabia and UAE further increase, then India needs to adopt a balancing act. The balancing act, and that could be that could make India's interest little bit difficult, or India's ability to balance between Saudi Arabia and UAE, it would be little bit difficult. But there has been an emerging tensions between these two countries, particularly over the influence in the region. And in fact, if we talk about India's stakes, so India's stakes including energy security, diaspora welfare, maritime trade routes, regional stability is actually one of India's core national interest. Right. So however, this India and Arab League meeting, it provides India with actually an opportunity to further strengthen its foreign policy and its diplomatic outreach to the West Asian countries, so that India can better protect its interests. So that is the objective of India hosting this second India and Arab League meeting. Right. So therefore, let's understand the key points about the Arab League, because we should also understand what exactly is this Arab League. Now, Arab League is a group which was founded in the year 1945. And the objective of this Arab League is to coordinate political and economic cooperation, or achieve political and economic cooperation. And in fact, this is a grouping among 22 countries. Now, what are the countries which are included in this Arab? Most of the West Asian countries. So you could see here the most of the West Asian countries, and you could also see on the map that along with these West Asian countries, the northern and some Western African countries are actually part of this Arab League. Right? Saudi Arabia is part of Arab League, UAE is part of Arab League, and most of these countries. Right? So therefore, there are 22 countries which are part of the Arab League. Now, in fact, also understand the objective of Arab League is to achieve political and economic cooperation. However, India pursues issue-based engagement, balancing relations with all major regional actors. And for India, energy is an interest. Diaspora is also a key concern. And along with that, India also follows a policy of strategic autonomy. So when India is following a policy of strategic autonomy, India actually avoids the bloc politics. India adopts the balancing act between the rivals, and India also deepens the multi-sectoral partnerships with a number of countries within the Arab League as well. Now, in fact, in several countries of this Arab League, so these countries are major oil producing states, and most of the diaspora is also living in these areas. So therefore, it actually makes Arab League a very important partner for India. Now, in this context, we have to understand the evolution of India and Arab League engagement. So if we talk about the evolution of India and Arab League engagement, so firstly, we have to look into the historical ties, right? So historical ties are actually India's civilizational and commercial linkages, because with most of these countries, India is having the civilizational ties, and India is also having the commercial links from ancient times as well. So therefore, these are actually some of the factors which help strengthen the people-to-people relations, which help develop durable relations between India and the Arab League countries, almost all 22 countries. And then institutionalization of the bilateral relations. So if we talk about the institutionalization of bilateral relations, the engagement of India with the Arab League was formally started in the year 2002, and a memorandum of understanding was to enabling a structured and political dialogue. A structured political dialogue, a memorandum of understanding was actually started or signed in the year 2002. And then India-Arab Cooperation Forum further established in the year 2008, right? So it was further institutionalizing regular consultations on political and economic cooperation. Then we need to talk about the diplomatic presence. So if we talk about the diplomatic presence, India's permanent representation to Arab League further strengthen the continuity and even the coordination in a multilateral engagement. After that, so there are some economic platforms which actually provided India and Arab League and a sustained and strengthened cooperation over a period of time. So that underscores the growing economic interdependence between India and Arab League countries. Right. So then we need to talk about the strategic partnerships and political convergence between India and Arab League. So understand that India has concluded the strategic partnership agreement already with a number of countries which are part of the Arab League, whether it is UAE, Saudi Arabia, Oman, Egypt, Qatar. So therefore, it actually helps further strengthening the defense and political cooperation between India and Arab League countries. And also understand that we have a vision of becoming Vikasit Bharat by the year 2047. That means India will become a developed country by the year 2047. And similarly, Saudi Arabia is also having a vision of Saudi Vision 2030. Right, so different countries within the Arab League have a vision. So therefore, India can actually align these vision with the vision of other countries as well, particularly converging the priorities between India and Arab League countries. And even several countries are already part of the BRICS multilateral grouping and even the Shanghai Cooperation Organization as well. And both these organizations, India is one of the key and very important member, and that will help further achieve alignment in the interests of both India and Arab League countries. And then the trust deficit is a challenge. The trust deficit between India and the Arab League is a challenge. So why it is a challenge? It is a challenge because understand that most of these Arab League countries are actually supporting Pakistan. So Pakistan is a concern for India because Pakistan has been sponsoring cross-border terrorism. And that's where there has been a trust deficit which is existing between India and Arab League. So there is a need to bridge the gap, and there is a need to reduce this trust deficit. So how it can be reduced? It can be reduced through sustained political engagement. And this sustained political engagement will help further reduce the historical mistrust, and it will further strengthen the strategic predictability in India-Arab relations. And then most of these Arab League countries also adopt a policy of strategic autonomy. So strategic autonomy primarily focuses on the core national interest of the countries. So therefore, since most of these countries have been adopting the strategic autonomy, and India is also having a foreign policy which is guided by the strategic autonomy, it actually helps both India and most of these Arab League countries to align their foreign policy priorities and also avoid rigid alliances in a multipolar world order. Therefore, it will help bridge build a multipolar world order. And then trade, investment and connectivity as other important areas. Now, if you look at the trade between India and Arab League countries, it has currently exceeded 240 billion US dollars. So 240 billion US dollars, it is actually a huge rate, and it actually indicates a deep commercial integration of India and the Arab League countries. And apart from that, if you talk about the investment flows from the Arab League countries to India, There are commitments from the United Arab Emirates, commitments from Saudi Arabia, and even Qatar also. They are ready to invest in India. They are ready to invest in infrastructure creation as well. So therefore, it will help India's infrastructure-led growth model if these countries are investing in India's infrastructure. And then India is also known as the net security provider in this region. So therefore, the critical sea lanes, particularly the Suez and Red Sea, Gulf of Aden, so that actually underpins India's external trade security. So an external trade security perspective also, the Arab League countries are very important for India, and this India Middle East Europe Economic Corridor, this was launched in 2023 G20 summit when India was the president of this G20 summit. Now, India Middle East Europe Economic Corridor linking India with Europe through the Middle East. For the success of India Middle East Europe Economic Corridor, most of these Arab League countries, particularly the West Asian countries, are very, very important. And then the strong connectivity through initiatives like India Middle East Europe Economic Corridor will help support the diversification beyond the hydrocarbons into manufacturing and service sectors as well. Now, if you look at the trade between India and most of these Arab League countries in West Asia, so most of the trade is dominated by the crude oil. So countries have felt that there is a need to diversify our trade needs. So therefore, the connectivity projects like India Middle East Europe Economic Corridor will help diversify the trade beyond hydrocarbons, and the trade will now include manufacturing and service sectors as well. And next, a very important topic is about, has health spending by the center increased in India? So this is the topic, right? So if we talk about the context of this topic, the context is with respect to or in the backdrop of Economic Survey 2025 and 26. The Economic Survey 2025 and 26 indicating that there has been a significant change or shift in health financing landscape in India. So how there is a significant shift in health financing landscape in India? Because the state governments have increased their spending, but union government's health expenditure as a percentage of GDP has witnessed a constant decline after the pandemic. So that indicating that the state governments have increased their healthcare expenditure after the pandemic, but centers' healthcare spending or their responsibility has been coming down as a percentage of GDP, particularly after the pandemic. So this has been pointed out by the Economic Survey. Now, in this context, if we look at healthcare spending in India, so health spending actually refers to the total amount of public and private expenditure on the healthcare related services, healthcare infrastructure and research. So this is what is known as health spending in India. Whether it is a public healthcare spending or private healthcare spending, but the total amount of spending on healthcare services, health infrastructure and research. Now also understand that the 7th schedule of the Indian Constitution, it divides the subjects into the union list subjects, state list subjects and the concurrent list subjects, and health is a concurrent list subject. So that means both center and state governments can make laws on healthcare because it is a concurrent list subject. However, if you look at the gross government health expenditure, now if you take into account the spending on healthcare by both central and state governments, it is approximately 1.1% to 1.9% of GDP. It is significantly less than what National Health Policy or National Family Health Survey has recommended, that India must spend more than 3% of its GDP on healthcare, but what currently India is spending less than 1.95 or 1.9% of its GDP on healthcare. So therefore this number must be increased. However, if you look at the out-of-pocket healthcare expenditure, this is the total money paid directly by the household This remains high in India, which is nearly 48%, and therefore it is a significant concern, and this has also indicating that the major portion of the household income is spent on the health care. And if major portion of the household income is spent on health care, so that will push the households into the poverty as well. So these are the concerns which have been existing in India. However, if we talk about the key trends in health infrastructure or health expenditure in India, so let's understand the center-state divergence in health spending, because the state spending has increased from 0.67% in 2017-18 to 1% of its GDP. However, if you look at the union government spending on healthcare, it has been dropped from 0.37% in 2021 to just 0.29%. So therefore, there is a significant drop, a significant decline in the health expenditure. Similarly, if you look at the budgetary allocations for the healthcare, the share of health in the total union budget fell from 2.26% during pandemic to just 0.5% in 25-26 budget estimates. This is significantly very low amount of budgetary allocations for healthcare, which has been indicating a constant neglect of health. And then there is an inflationary impact as well. In real terms, the union health allocation for 25-26 is 7% less than what was actually spent in 2021. And in fact, the union government also imposes the healthcare cess on certain products. So whatever money that has been collected through this cess, only the central government will retain, and the central government will use this cess money for the specific sector, whatever sector it may be. It could be healthcare sector, it could be education sector. So therefore, only 1/4 of the health and education cess collected in financial year 24 was actually funneled into the healthcare. So this is a significantly very less amount of money that has been collected and spent on healthcare. And in fact, in recent times, the centrally sponsored scheme squeeze is also taking place, where the union transfers to states for schemes like National Health Mission, so which are actually dropped from 75.9% for its health budget in 2014-15 to just 43% in 2024 and 25. So these are the key trends in healthcare expenditure in India. Now, what is the need for increase in the health expenditure for a country like India? So of course, there is a need to increase healthcare expenditure. Now understand that the national health policy has set a goal of 0.5% to 3% of the GDP must be spent on the healthcare. But as of now, how much we are spending? We are spending just 1.9% of our GDP on healthcare. And in India, out-of-pocket healthcare expenditure is also nearly 48%. High out-of-pocket expenditure will push millions of people into the poverty cycle almost every year. Right? So if you take into the global average of this out-of-pocket healthcare expenditure, now in fact, in India, the out-of-pocket healthcare expenditure is very high as well. And in fact, there is also a need to further strengthen the primary healthcare facilities in India. So the major focus should be on the primary health care, and therefore there should be infrastructure, there should be healthcare professionals, and there should be the relevant monetary support or the financial support. And there is a need to integrate ANM, ASHA and Anganwadi workers at the primary level, because the primary healthcare centers can actually play a very important role in the overall success of healthy India. And then the non-communicable diseases burden has also been increasing in India, along with the persistent infectious diseases, because the total cost of this non-communicable diseases in India is estimated to be 6 trillion by 2030. So therefore it requires massive investment in the preventive screenings. And then if we talk about the universal health coverage, now in recent times the government has increased the health insurance coverage to elderly for seniors who are above 70 years as well. So we knew that there is a program called Ayushman Bharat. So this program called Ayushman Bharat, right? So Ayushman Bharat was launched, and it is a health insurance scheme, and it provides 5 lakh rupees of health insurance to every household. Earlier it was not extended to senior citizens, but recently the government under Ayushman Y Vandana, so this scheme has been extended to the senior citizens as well. So therefore expansion of insurance should be matched by public infrastructure to ensure the quality of healthcare services for the people. Now, what initiatives have been launched so far to ensure quality healthcare? So Ayushman Bharat health scheme has been launched, which provides 5 lakh rupees of health insurance coverage to every eligible beneficiary. And then a 64,180 crore mission has been launched aimed at plugging gaps in healthcare infrastructure and pandemic preparedness until 2026. And Telemanas program has also been launched, and this is a national mental health helpline. And this mental health helpline at the national level so far handled 28 lakh calls and was upgraded in 2025 with multilingual AI chatbots. And Ayushman Arogya Mandirs were also established, transitioning the health and wellness centers which are established under the Pradhan Mantri Jan Arogya Yojana into a comprehensive primary health care establishments. Understand, the health and wellness centers were established under the Ayushman Bharat program. So therefore these health and wellness centers have been transformed into the comprehensive primary healthcare hubs. And Ayushman Bharat Digital Health Mission is also another initiative that has been launched to provide quality healthcare to achieve the objective of universal healthcare. Under this program, 72 crore Ayushman Bharat Digital Health Mission cards have been provided, and it helps in seamless digital health record across the country, maintenance of these records, retrieval of these health records as well, so that quality, reliable health care is provided to every eligible beneficiary. So I hope you have understood this, and that's all for today, and thank you so much.